Dr. MacLaughlan, how does socioeconomic status impact treatment and outcomes in advanced stage cervical cancer?
So, first of all, I'll say that cervical cancer is largely a preventable cancer. And socioeconomic status and other psychosocial determinants of health are usually contributing to an individual's ability or access to get preventative care. And so our patients who are presenting with advanced disease, or even most patients who are diagnosed with cervical cancer have not had adequate screening. And so socioeconomic status and other social determinants of health really plays a role in whether or not the cancer can be prevented to begin with. The best cure is to never let it happen. Now, when it comes to outcomes in advanced stage, there's two things that I would point out. Number one, we do have some qualitative research, not my work, but some really important work that demonstrates that when reviewing a medical record, you are much more likely to identify negative language coming from a provider as a descriptor for a patient. If the patient is from a vulnerable community or from a lower socioeconomic status or is not white. And that doesn't necessarily mean your provider is saying bad things about you. What it's saying is, this is my least favorite, but I still see it, this unfortunate patient. Another example would be, this patient is non-compliant. And the word non-compliant, what a provider should mean by that is that that person is not able to do everything we ask of them. Well, that could be because we are asking too much and not listening to them for what their goals are and what they're needed. So an alternative of describing that would be, these are the things that the patient can do, as opposed to emphasizing what we're telling them to do that they're not doing. All of that is evidence of implicit bias. And implicit bias and systemic racism are things that are really hard to undo unless you go back to the beginning. And in this case, that means research. So when it comes to outcomes in treatment for advanced cervical cancer, I have to point out that though we have had some exciting advances in treatment of recurrent and metastatic cervical cancer, I have to point out that there are very few patients of color on those clinical trials. Most of them are done in Europe or in predominantly white privileged communities in the United States. And that has to do with ease of participation in clinical trials, because it's hard enough to get yourself through cancer treatment. We are extremely demanding of our patients and survivors. And then you add to that a clinical trial protocol, it's even harder. There's more visits, there's more. And so those coming from marginalized, underrepresented communities aren't represented in the research being done to find cures. So that means we may find something that we think works. We don't know if it's going to work in a patient who has no one similar to them who participated in the treatment before. And so until we can really be inclusive in the clinical trial research, and even not just clinical trial research, but all kinds of research, meaning learning more about tumors that grow in particular communities and what's going on in community levels or at the community level with extrinsic sources of stress or exposures or pollution or health outcomes or food insecurity. All of those things are going to play a role in someone's health. And the healthiest people are most successful at surviving cancer treatment, let alone the cancer itself. My activation tip for this is no matter what your experience may be, when you go to a doctor or other provider with cervical cancer, whatever that experience is, I want you to know that, one, you are not alone. You are not the only person experiencing this. It is not your fault. You are not to blame for this. And so whatever you may feel or experience in the clinical encounter or the encounter with the academic centers or the cancer center or the front desk or in radiology, whatever you experience, know that you are a survivor, know that you are strong and resilient, and please do not feel shame.